All right, so welcome everyone to the information session for the Masters of Science in Health in the Public Interest program. We're really excited to talk to you today about our program, and we hope that you have had a great Thanksgiving break and you're looking forward to our next holiday break coming up here. So today we're going to briefly introduce ourselves and our roles within the program. Then we're going to go into the program itself, kind of what makes this unique from a typical public health degree. Then we'll go into career opportunities and alumni outcomes, followed by a brief overview of admissions and what to expect when applying to the program. And of course, plenty of time for all of your questions about the program and other ways to contact us and get in touch. So first of all, my name is Jennifer Jansen or Jenny Jansen. I use she, her pronouns, and I am the program coordinator for the MS program. What that means is I'm essentially the advocate for students who are both prospective, applying to the program, and currently in the program. I'm a great resource for things like finding the resources you need to apply to the program to succeed in your degree, whether that's finding funding, finding other resources the university offers, finding career opportunities, kind of anything in between those guidelines. Next up are our two co-directors, Dr. Feuberman and Dr. Myers. I will pass it off first to Dr. Myers, and then we will talk a little bit about our faculty and the other people that make up the program.
Good morning. It's great to be here talking to you today. I'm Dr. Adam Myers. By training, I'm a cardiovascular physiologist and was associated for many years with Georgetown School of Medicine. And along with Dr. Fu Berman, or through her influence, I've gotten interested in public health related things and happy to be involved in this Masters in Health in the Public Interest, which we started some 7 years ago. Adrian, Dr. Fu Berman.
Hi, I'm Adrienne Fu Berman. I'm trained as a physician and I've been at Georgetown for about 20 years now. So I'm in the Department of Pharmacology and Physiology and also the Department of Family Medicine. I run a project called Farmed Out that does research and education on how the pharmaceutical industry manipulates the prescribing habits of physicians. And I also run a project called Urban Herbs that maintains ecologic gardens on the Georgetown campus that are used for a lot of different purposes. And this is our 7th year running the Health in the Public Interest program. These are some of our other faculty. Dr. Dutton runs our summer course, Health and Disease and Society. And that's a kind of social sciences boot camp of about 3.5 weeks. It's a virtual course that's taught by Dr. Dutton's a cultural psychologist, and then there's also an anthropologist and a sociologist who teach in that course. And it's a really great grounding for the rest of the program. Dr. Shally is an OBGYN reproductive endocrinologist who teaches our Theory and Methods of Epidemiology course. And Lynette Golding works for Save the Children. So she works full-time there, and she teaches our health communications course, which is also a really great course. Next. Pam Saunders teaches our Theory and Methods 2 course, which is qualitative research. So Theory and Methods 1 is more quantitative, and then Pam teaches the more qualitative course, and Dr. Knight Marver teaches our Biology of Health and Disease course, which is it's a great course for, we get a variety of different students coming to our program, and some have a biology background. Many do not have a biology background. And so this course provides that background. And Dr. Turbet teaches a health economics course. So we're very cross-disciplinary in the program. And Dr. Sherman, well, he teaches a nutrition course, but he also teaches in biology of health and disease. And Dr. Weinstein teaches several, she's a demographer, and she teaches several electives as well. But there's many other electives that you can take as well. Georgetown's a great place to study. DC is a wonderful place to be for those who are interested in health advocacy. There's always a lot going on. There's probably going to be particularly interesting the next few years. So we anticipate there'll be a lot of a lot of opportunities to learn. Um, anyway, is there more that you wanted to say, Adam? You normally do this part. Oh, you're on mute.
Sorry, I have a dog that was barking, so went on mute. So the Health in the Public Interest Program is a program that really emphasizes advocacy and activism, and as such, you're going to be, as Dr. Fu Berman mentioned, engaging with diverse students and taking courses in a variety of fields. We'll talk more about that later. And you'll have opportunities to in the environment of Washington, D.C., take part in some of the policy and legislative processes that go on here. Um, so in addition, Georgetown is a Jesuit Catholic university, which from the standpoint of our program means that it's rooted in the values of higher education, which the Jesuits espouse, as well as care of the whole person and social justice. So that fits in real well with our goals in promoting advocacy for underserved peoples and reform of current healthcare processes and policies. Next slide. So as I think I was just inferring, HAPPY, the Health in the Public Interest Program, looks at public health in a way that takes into account societal, social, and cultural factors that affect health and healthcare. We're not really looking at clinical medicine at all, but the non-clinical factors that affect health and healthcare delivery. So the challenges that we face in this area are big. I think they are getting bigger with the change in administration, and we really look at this as an opportunity to work for change and come up with creative solutions. And the interdisciplinary approach that we use is particularly useful in that regard. So the core curriculum of the program is um, similar to that in public health programs, but also a little bit different. We have a course in the pre-fall session in August that emphasizes health, disease, and society. In other words, the social determinants of health and factors. To start you off with, it's led by Dr. Yulia Dutton, as I said that wrong, Yulia Chensnova, as you saw on a previous slide. In the fall, we have courses in health advocacy, biology of health and disease, and a theory and methods course. The spring, there's a second theory and methods course, a health economics course, health communications course. But more than that, you take electives that help you round out the curriculum in a way that kind of molds the program toward what you're interested in. Next slide, please. So, next, please. So, a little bit about the program. Jenny, do you want to jump in here and just talk about some of these factors?
Yes, sure. So, as we say here, our goal is to teach you to be a knowledgeable, caring advocate for a rational healthcare system and policies. So we are really focused on that kind of advocacy aspect that Dr. Myers highlighted, and we're interested in doing things a little bit differently, which is why you see such interdisciplinary coursework, and also why we give you the opportunity to complete up to 2 elective courses during your study that can also be taken in external schools such as the Georgetown School of Health, occasionally the Georgetown School of Law, McCourt, the Public Policy School. There's a lot of opportunities to kind of personalize your curriculum in a way that works best for you. While we do not have a confirmed tuition rate for the next academic year yet, we are closing in on that now. It is very likely to be the last tuition, subject to a 4% increase, as is what usually happens across the university. So definitely keep that in mind. But for this current year, our tuition was just about $60,000, which translates to around $2,000 per credit. For this curriculum, if you complete it full-time, it will take you approximately a year. Students typically complete it in 2 to 3 years if they are completing it part-time. For those 30 credits, most of them are going to be core courses like the ones we just listed. However, you have 6 elective credits to complete, which translates to roughly 2 classes, plus a 3-credit capstone project, which translates to either a research project or a sort of internship for 6 weeks where you work with a local or national organization of your choice in kind of your desired field or aspect of public health. Another great series we have that is a really great way for people to get a sense of what interests them in public health and how to secure a partnership with one of these health organizations is our seminar series, which we'll go into later. But this is essentially presentations and discussions with public health leaders, such as Kenda Sutton-El, the founder and director of Birth and Color, which is an organization that trains people of color to become doulas, and also kind of trains Black families on what to expect when they're expecting. And we've also had things all the way to water justice and handling the Ebola crisis as kind of topics of our seminar series.
Okay, so this is just a layout of our year-long schedule, and I've gone over most of this, but what I want you to focus on here is that in addition to those core courses of Health, Disease, and Society, Theory and Methods 1 and 2, and the others, there's an opportunity, as Jennifer said, to take a couple of electives, one each semester at least, and this allows you to kind of direct your education in the direction that you want to go. Now, another point is that the biology of health and disease is a course in biology and health, and many of you are going to be taking this course, but if you are a biology major, a pre-med major, in some other manner, have taken a fair amount of biology to begin with, you might be exempted from this course, which will allow you then to take 3 courses as electives. These elective courses we'll see a little bit more on later, but they can be in any of the schools at the university for the most part, and can help you to modify your curriculum. Let's say you're interested in women's health, reproductive rights, any particular area within public health, or health policy, you could pick courses to put your education in that direction. In addition, in the seminar course, you can see that it's listed as 0 or 1 credit. That's not a reflection of a different course, but simply it's a mechanism to allow us to kind of keep your credit load at 30 credits so you don't end up paying extra tuition money if necessary to take what would otherwise be 31 credits. You see that in the second summer, you have a capstone or internship project that Dr. Foo-Berman will talk about in more detail later, but it's an opportunity then to go out into the field, meet new people, network, and again, explore an area and perhaps an organization, a potential employer in your particular area of interest. Next, please. So we also have a part-time program, and this is an in-person program. I should have mentioned earlier that the only virtual courses that we have are that first summer course, pre-session course, rather, I should say, Health, Disease, and Society. It's taught in August, and we do that via Zoom to allow you to transition to Washington, D.C. At your own pace. Um, and then the seminars are also on Zoom simply because we found that to be a better medium for doing seminars. We could get more participants from outside of the program, and we could get some really outstanding speakers. So next, please. So these are just some of the electives that can be taken. Georgetown has a very wide array of graduate programs. Graduate students outnumber undergraduate students as they do in many Research One universities. So you have a selection of a great variety of courses that you can use to meet your personal interests. Next, please. So, Adrian, we're at capstones. I think you're going to want to talk about that.
Yeah, the capstone project, the capstones are a really important part of the program. So it's experiential learning. Most of the students do it in the second summer after of the course, but some students have done sort of part-time capstones over a semester or two. That's sort of more unusual, but that can happen as well. So that can be like a job at a nonprofit or at a government agency, or it can be a research project in a lab or in another setting. Occasionally, it's been an individual project with faculty support. We've had two students generate book proposals, for example. And there's one of the students has published a book, and the other one is still working on one. But so that's more unusual. But there's lots of things that students have done. So these are some examples of what students have done. Some students have come to work for my Farmed Out program. Others have gone to NIH or to Health Resources Services Administration or another government agency. Some students have done research with researchers at Georgetown. And these are just a few of the, and some people have done international work as well, or done international capstones. Next slide. And these are some other examples of working for nonprofit groups or government or for-profit businesses as well. So whatever students are interested in will help students get capstones. Often students find their own. They have to be approved by me, but will also help anybody get something within within what they're interested in. Next slide.
Okay, so these are just some of the examples of seminars we've had recently, relatively recently. Oliver Johnson talking about his experiences with Ebola 10 years ago and their implications um, to the threats of Mpox and avian flu possibilities today. Dr. Anthony Fauci, who's now a university professor at Georgetown, and he spoke to our students on his experiences over his career with HIV, AIDS, and of course, his experiences with the recent pandemic. So we've also had talks by a number of other well-known people. I would suggest that you try to come to one or two of our seminars on Zoom while you're in the decision-making process of whether you want to attend our program. It's on Wednesdays on Zoom. Actually, this Wednesday is the last talk for the semester. It's going to be by Dr. Adam Visconti, who is a practitioner in DC, the former medical director of the DC Department of Health, who's going to be talking about HIV, AIDS, and sexually transmitted infections in Washington, D.C., and approaches taken to both study them and to control those infections. Next slide, please. So our alumni have taken very many career paths. Our program is different from a public health program in that many of our students, instead of pursuing traditional careers in consulting and statistics and government health and health policy agencies, they look at a wider group of organizations and settings in which they can practice advocacy and activism toward a better healthcare system. We really want people who are going to go out and try to make a difference in the healthcare system um, as opposed to fit into the current system as, let's say, an epidemiology researcher or biostatistician, policy researcher, et cetera. We want people who want to make change and understand that the current healthcare system, while broken, can be reinvented to take into consideration the social determinants of health and what people really need. Next slide, please.
All
So,
right.
yep.
I'll talk a little bit now about what to expect when applying to the program and other things to know about eligibility for admission. So first off, here is a handy application checklist we have for everything we need from you to be considered for matriculation. So feel free to screenshot or take a picture if that's helpful to you. The first thing you'll need, of course, is the completed application form. All of this is done via an online portal for the graduate school. You'll just select our program as your program of interest. Second is the application fee. We have about a month and a half left of our priority deadline. So definitely recommend getting in before that because that will allow you to have your application fee waived. If you apply after that deadline, no worries, we'll still accept admissions on a rolling basis until April 1st. However, there will be an application fee of $90 for that. Next up is your statement of purpose. This is up to 500 words where you can discuss your academic journey, what brought you to apply to the program, and what you hope to get out of it. Because we're a program who's very interested in really curating our small cohort and getting to know how they're looking to use the program and kind of advance themselves, we also strongly urge applicants to fill out the optional statement on personal background. This is another up to 500 words that gives you an opportunity to expand on your personal background, your own experiences, and how you feel they contribute to your interest in this field. And it also gives you a really valuable opportunity to show how you've already contributed to your community or how you look forward to contributing to ours. We really welcome any opportunity to get you to know you more through your application. So this is a really great statement to sort of add on there to give extra context to your application. Next up, we will need a writing sample to assess your preparedness to write and perform at the graduate level. This does not need to be written for the application. Most commonly, students will submit things like research papers or capstone projects from their undergraduate degrees, but we also welcome things like professional papers, op-eds, technical reports, etc. For your resume and curriculum vitae, you can submit that like normal. And then we would like to have 3 letters of recommendation. If possible, we'd really like to have one of your recommenders be an academic you've worked with, such as a professor, because this gives us a good sense of what you'd be like in the classroom. However, if you've been out of school for a while, you can use responsible individuals from a work environment. That's fine. Just for those of you who are maybe finishing up your undergraduate degree or still kind of in touch with those contacts, it's good to aim for at least one recommender being an academic you've worked with in the past. With this, all you're going to do is enter the contact info and the email address of your recommenders into the application portal, and they will receive email instructions on how to send in their letter. You can also send them reminders and check the status of these letters through the portal. We will accept and be an application by both deadlines that still needs the letters, so don't worry about having those ready to go. As soon as you submit, we'll give you a couple weeks to make sure those recommenders get those letters in. So if that's something that worries you in trying to make the January 15th deadline, we encourage you to still get that in anyways. We'll kind of see it as complete and not charge you a fee if your letters of recommendation come a little bit after that. Next up, as soon as it's available, we will need a transcript with your undergraduate degree on it if you're currently completing that. Essentially, we need proof that you did complete your undergraduate degree at a four-year university. And we will, of course, need an official transcript copy to make a final decision with the graduate school and officially admit you into the program, should you be eligible for admission. However, like the letters of recommendation, we will accept your unofficial transcripts by each of the deadlines, both the priority and the rolling deadline. So again, like recommenders, don't let that worry you about kind of having all your ducks in a row for submitting the application, but just make sure that that's something you're able to secure down the line. Finally, for those of you who are non-native English language speakers, we require a demonstration of English language proficiency test. This requirement is waived if you attended an English language school. However, if you feel this does apply to you, you'll see on the right there the minimum scores required to be eligible for admission. So we know you're kind of proficient in completing coursework in English. These are the two types of tests we accept. And you'll also see that we do not require a GRE test. So, what does it take to be considered eligible for admission? First of all, you must hold a bachelor's degree or equivalent from an accredited institution. This would translate to a four-year undergraduate degree in the United States. For those of you out of the States, it's helpful to have a WES evaluation so we can accurately compare your transcripts to the American education system. Next up, as we said, we're really passionate about people that are passionate. So, demonstrated interest in public health related fields such as healthcare, health equity, reform, and advocacy are all strongly preferred. We really want to know what makes you tick and what brings you to this program. So those are always really great things to kind of explain and expand on in your written materials and your application at large. Finally, the Graduate School of Arts and Sciences requires a minimum GPA of 3.0 on a 4.0 scale to be considered eligible for admission to our programs. However, I do want to draw your attention to this little blue box in the corner here, because what that means is we conduct a holistic review of applications. We have a small size, we want to get to know our applicants and what draws them to the program, and we also acknowledge that not everyone has the same professional or academic journey. So if you are concerned about any of these eligibility requirements, we encourage you to reach out to us via our email, which is hapi@georgetown.edu, or reach out to me. Because if you feel like you are otherwise a compelling candidate, there are cases where we can make an appeal to admit people who don't meet all of these requirements. These are the application deadlines I mentioned. The first one is the priority deadline. This is a great one to hit because you have priority merit aid consideration and your application fee is waived. That will be on January 15th of this year. And we will continue to review applications on a rolling basis until April 1st of 2025 for our next cohort. And the application fee after January 15th is $90. Please keep in mind our fall pre-session does fall under the fall semester. So when you're applying for admission, apply for fall 2025, not summer. Finally, let's talk a little bit about financing your degree and some resources we can help you with. Again, we do not have a confirmed tuition rate for the academic year of 2025 yet, so I would recommend checking out the Graduate School of Arts and Sciences website and kind of anticipating a 4% increase on that, as that is the typical trend. We offer limited merit-based aid for competitive applicants. Everyone is automatically considered when they submit an application, so there are no extra materials applied, but we do strongly encourage you to apply by that priority deadline of January 15th to get full consideration. Otherwise, the majority of students finance their degrees through multiple sources, such as merit aid, employment tuition benefits, which if you are currently employed, you should reach out to your employer to learn more about. and also things like fellowships and scholarships. We have a couple of offices that are very useful to admitted students. So should you be admitted to the program, you can reach out to the Office of Graduate Fellowships and Scholarships. They have a lot of great resources on great scholarships that students usually apply to. They have a monthly newsletter you can subscribe to keep being updated. And it's always good to get researching for them as early as possible because a lot of the deadlines end when the semester begins in the fall. One of the other reasons why we have so many part-time options for this program is in order to accommodate those using employer tuition benefits. For example, most of our courses begin in the evenings around 4 p.m. Our seminar series is virtual, so you can have that during a lunch hour at work, say. And we're happy to work with you to see kind of what works best for your schedule, and how you want the program to kind of run, how many classes you want to take when you're a part-time student. If you believe that you're eligible for Veterans Affairs benefits, you should contact the GU Veterans Service Office for more information on starting that application process, and you can also schedule appointments with them on their website. Graduate students are indeed eligible to submit the free application for federal student aid, or the FAFSA. It just opened up on December 1st, so it is now open for the next academic year. This could find you eligible for federal low-interest student loans or for federal work-study, which would allow you to apply to federal work-study designated positions on campus. So we always encourage students to fill this out, just see if they're eligible. It's free, why not? And speaking of part-time work, students are eligible to work up to 20 hours a week at the university while they are pursuing their degree. There is a number of jobs and positions across campus, across different departments we work with. So you're welcome to apply to any of those jobs and get a sense of different programs and how they work too. For example, our program is currently employing someone from another master's degree at Georgetown, which is doing excellent. So there's always opportunities to kind of get to know other departments and find employment and internships that way that can help with finances. Finally, the Georgetown Office for Revenue and Receivables offers monthly installment payment plans. You can sign up for this through the normal billing portal for Georgetown University. We also have a Graduate Career Center, which offers a number of resources to find and apply to external scholarships and fellowships, including an opportunity to be matched with a personal career mentor. All right, so thank you so much for attending today. It's been a pleasure to chat with you about our program. And now we want to open it up a bit to your questions. In order to ask a question, feel free to type in the chat, to go off of mute, or use the raise hand function, and we'll be here to help.
Molly.
It looks like Molly has raised a hand.
Hi. So I was wondering how big the program is because you've mentioned that it's a small cohort, and also like what your acceptance rate has been. I know it's a newer program.
So
Um,
we get over 100 applications a year, and we seat typically 12, 14, 15 students. We don't want to be much bigger than that. I think we have an absolute cap of 20. So it's a very kind of individually tailored program that you develop and a cohort of students that you're going to be very close to. Our acceptance rate for students who actually complete their applications is probably 50% or so.
Thank you.
Sure.
All right. We also have a question in the chat. Well, in the program, can you take classes from the undergraduate school as a non-degree seeking student?
So well, I wish the dog would stop barking, but let me address that. So, undergraduate courses, I guess your question implies that you understand that they can't be taken for graduate credit. You can certainly talk to another department about taking a course. You'd have to take into consideration how that's going to affect your schedule and your load, but it's also going to be a financial thing because the tuition for the program is for 30 credits, and those credits aren't going to count. So the rest of the credits that you take would be charged at the regular rate. So, yeah, okay. So, Avi, I don't know what your intention would be, but sometimes people have taken a single course, for example, if they needed to take a course as a prerequisite for some other kind of program, after this one. That's typically the reason they take it, or something that's a big personal interest. So it's possible. It costs more money, and it needs to be well thought out and scheduled.
Yes, if you're thinking in terms of electives, electives should be courses available to graduate students at the graduate level to be counted for that course credit. Claire is asking if most students in the program are recent undergraduates and what types of students participate in the program generally.
So, say the majority are recent undergraduates, but we also get people who are, we get a few people who are mid-career and actually a fair number of students in their late 20s or early 30s who are making some kind of change. But our oldest student to start with us was 54. He was a former restaurateur who wanted to switch into health policy, which he has done successfully after completing our program. And what types of students participate in the program? We really get a variety. We sometimes get students who started off as pre-med and decided that wasn't for them, but they were still really interested in health. We get students who are really interested in changing the system, but they come from a variety of educational backgrounds. So everything from philosophy to biology to psychology. Yeah, so a variety of educational backgrounds. And we always have several students who are working full-time while they're here, either in the government or Georgetown or in some other job in DC.
Yeah,
Yes.
one thing that we didn't mention yet is that it is possible to work and go to the program at the same time. As Dr. Fuberman just said, we so strongly suggest that you can only do one of those two things full time. And some students who are full time have even found that a part-time job was more than they could handle at some point, and either took some time off or left those positions. On the other hand, DC is full of internships and volunteer opportunities, and a large number of our students do have some kind of part-time thing that they're doing, whether it's a job, an internship, or a volunteer position.
I mean, I can't think of a part-time student who left their job.
I didn't mean to say that if I did.
Yeah.
Yeah, no, full-time students have even left part-time jobs, is what I was trying to say, because it got to be a bit much.
Yeah, it can definitely depend on kind of what you feel like works best for your kind of like work ethic, your workload, how you best kind of study, juggling two things at once. But we definitely don't recommend pursuing work and school full time at the same time because this seems to be a
Yeah.
lot of strain on students, even though it's technically possible. Um, in answer to Avi's question in the chat, you can absolutely apply to the program as a senior in undergraduate study. I mentioned that you should have confirmation of your undergraduate degree in the sense that once you get your official transcripts, make sure it indicates that you completed it because sometimes we've had people submit their degree analysis and it didn't actually show that they completed their degree. So that's just a good thing to check for. But we will accept your unofficial transcripts, even if your degree is still in progress by the deadline, because we can still get a sense of your academic performance from that. Yeah, So we're just trying to make sure that you do graduate and complete an undergraduate degree before you start the program, as that's a requirement of admission.
Molly.
Could you also talk a little bit more about the benefit of it being an MS rather than an MPH?
Yeah, so let me address that a little bit. So classically, MPHs are designed really as a course that's for people who are actively pursuing um, a public health career, usually as with some experience in the field already. If you look at some big MPH programs at places like Hopkins, if you just have an undergraduate, just if you have an undergraduate degree, but are not yet experienced in the healthcare world, they'll put you typically into an MS program. And there is also the thing at many research universities that if you want to get ultimately a PhD, they'll tell you that you should do the MS instead of the MPH because the MPH is in a way a terminal degree. There are PhDs in public health, but an MPH is a well understood degree with the basic tools for being um, for working in the current public health system. So we have some of the components of that. We have a health communication course. We have methods and theory courses. Um, we have health economics. So some of the key elements of an MPH, but they're not all taught in the same manner. For example, the theory and methods courses are more about um, developing the ability to understand and critique and incorporate findings of published literature into policy and action, as opposed to training anybody to be a biostatistician or an epidemiologist. And having said that, we have had students who come out of our program who are currently working in the public health field with titles like epidemiologist. So it's a relatively fine distinction, but a real one.
Well, yeah, because the epi course is not a straight epi course. So it also includes ethics. It also includes, critical reading of the literature. You don't have to learn statistical packages. So it's pretty light on actual stats. But yeah, as Dr. Meyer said, some students have gone on to do epidemiology. But if that were your ultimate goal, I wouldn't do our program necessarily, even though some students have done that. So we cover a broader range of subjects than MPHs do, but we're also like Dr. Meyer said, like we're really focused on trying to change students to change the existing system, so the advocacy part and the getting to know people in a lot of different fields, and seeing like the seminar series really exposes students to people who are working in very different careers. So it's very interesting to us to watch students sort of solidify over the year in terms of what they want to do because of who they've met and who they've been exposed to and the different subjects that they've been that they've been exposed to. And also you can tailor your program more because since there are electives, some students have been particularly interested in bioterrorism or particularly interested in immigrant health, and they can use their electives to kind of create a concentration in that.
That's really helpful. Thank you.
In terms of recommendation letters, should they be specific to Georgetown or should they be more general along the lines of a general graduate's study in public health? I mean, the recommendation letter should be about you, right? What are your capabilities and really what your capabilities are academically. That's really what it should be about.
To address a question by Olabucio, um, On a scale of 5.0, the minimum GPA required would basically be 80% well, so on a 4-point scale, it should be 3%, right? 3.0. So on a 5.0 scale, it's 75% of 5, whatever that is. And I'm not coming up with that number in my head. I'll calculate it while we're talking about something else.
Other questions? Well, if there aren't other questions, please feel free to email us. So Jenny or Dr. Myers or I, we're always happy to respond to email. So just let us know if you have any other questions. Molly, did you have another
Yes.
question?
No, thank you.
No
Okay, so
worries.
the GPA requirement would be 3.75 on a 5 scale, but keep in mind that all of this is looked at in the context, as Jenny mentioned, as a holistic review of the credentials. So if we're talking about a 4-point scale, some people with just over 3.0 aren't going to be admitted, and occasionally we will take somebody below that if they demonstrate exceptional skills in other ways, or perhaps are several years out of their degree and have demonstrated professionally their capability. So it's all looked at holistically.
Yes, so definitely I think the goal of your application should be just kind of representing yourself as the best candidate as possible and kind of advocating for why you think you would be a great admit to the program, because we'd love to learn about that. I put up our contact information on the screen. You can reach out to my personal email or our program email, which again is hapi@georgetown.edu. We also have our phone number if you ever want to call, and you can set up office hour meetings with me as well if you'd like to be more face-to-face. Other things we offer are tours around campus, chats with the program directors. As Adam mentioned, we really recommend attending our seminar series and getting a sense of what that looks like. All the students attend it as part of their coursework, as you saw, so you can get a sense of what they're learning and the questions they're asking. And finally, I put up our social media because this is also a great way to see what we're up to and sign up for the seminar mailing list. You can also email me to be added to that mailing list, and the link is available on our website. But we'll usually post our seminar series there, or some great highlights from the past, or what our students are up to, what they're organizing. So those are always great places to get more of a sense of what the program is about as well. But yeah, feel
Come
free
to
to
our
reach out.
last seminar tomorrow if you want to
Yes.
meet our current students and see what a seminar is like.
Yes, that'll be at noon tomorrow on Zoom. I posted about it on our Instagram if you want to grab the link to register there. And beyond that, feel free to email us with any questions that came up after this. And I hope you all have a great rest of your afternoon. It was a real pleasure having you with us.
Yeah, thanks so much for coming. We look forward to seeing your applications and wish you a restful and enjoyable holiday season coming up.